What could be causing the bleeding 10 days after a period?
Hello, viewers. Today we're going to discuss an issue that affects many people who menstruate: bleeding 10 days after a period, also referred to as mid-cycle bleeding. Understanding your body's cycles and signs can be complex, so we're here to demystify this topic and help you understand possible causes and when you might need to seek help.
What is mid-cycle bleeding?
Mid-cycle bleeding, also known as intermenstrual bleeding or spotting, is any bleeding that occurs outside of your regular menstrual period. It's usually light and you may only notice it when you wipe or notice a few spots of blood on your underwear. This can occur for several reasons and isn't always a cause for concern, but it's important to monitor it and consult a healthcare professional if you're worried.
What could be causing this bleeding?
There are several reasons why you might be experiencing bleeding 10 days after your period. Let's take a look at the most common causes. 1. Ovulation. Some individuals may experience light spotting during ovulation, which usually occurs in the middle of your menstrual cycle. 2. Hormonal fluctuations. Changes in hormonal levels, especially due to the use of hormonal birth control methods like the pill, IUDs, or patches, can cause irregular bleeding. 3. Stress. Excessive physical or emotional stress can disrupt your menstrual cycle and potentially cause spotting. 4. Sexually transmitted infections, STIs. Certain STIs, like chlamydia or gonorrhea, may cause bleeding between periods. 5. Polyps or fibroids. These non-cancerous growths in the uterus or the cervix can lead to mid-cycle bleeding. 6. Endometriosis or adenomyosis. These conditions involve the growth of uterine tissue outside the uterus or into the muscular wall of the uterus, respectively, and can cause irregular bleeding. Please note that this list is not exhaustive, and the cause may be different based on individual circumstances. Always consult a healthcare provider if you're experiencing unusual bleeding.
When should you seek help?
While occasional mid-cycle bleeding may not be a cause for concern, it's important to seek medical advice if you notice any of the following. The bleeding is heavy or persists for several days. It is accompanied by other symptoms such as pain, dizziness, or fever. It occurs after sex. It is a new symptom for you. Don't ignore changes in your body. Your healthcare provider can help you understand if the bleeding is part of your regular cycle or if it may be a sign of something more serious. Bleeding 10 days after a period can be due to various reasons, from ovulation to underlying health conditions. It's essential to keep track of your menstrual cycle and note any changes or irregularities. Remember, it's always important to consult a healthcare provider if you're unsure or worried about any new symptoms. We hope this video has been informative and helpful. Take care.